Hey guys, Dr. Jesse here, and in this video, we're gonna walk you through a simple spinal hygiene program that you can apply anywhere, anytime. This routine should take you less than probably 5 to 10 minutes a day, but will make all the difference when it comes to increasing mobility, stability, and having less pain in your back. So number one, we have to increase motion in the spine first, because remember, those joints send signals to the brain. The brain then controls the muscles around the joints, which is where the stability comes from. So if you've got a healthy joint, you've got a good signal, the muscles around that joint are gonna be soft and they're gonna be strong. But if your joint is stuck, bad signal to the brain, the muscle's gonna be tight and it's gonna be weak. And this leads to instability. So we wanna get these joints moving. So Shelley, we're gonna show a simple cat camel. So the idea of this is we're increasing mobility in the small joints in the low back and pelvis. So Shelley's obviously on all fours and she's gonna drop her tummy toward the floor and really feel for the stretch in the back. This isn't a muscular workout, this is a joint workout, okay? And then coming back up for me, Shell. And we're doing the exact opposite. So what you're doing is you're taking your joints in your small back through a full range of motion. Now, when you think about it, how often do you ever do that? It's like, we usually just sit in the exact same range of motion, which is very limited on a daily basis. Going to the extreme is rare, but super healthy. Now, Shell, can you stand up? And what we wanna do is some simple controlled spinal rotations. So in this case, what Shelley's gonna do is keep her pelvis still, and she's going to twist, so all the movement's coming from the lower back. Gonna go one side and then the other, and we're doing around about 10 repetitions for each one. Again, super simple and quick. This stuff is powerful and it works only if you're consistent. So this is a daily habit that you want to start to build. Now, next thing is as we start improving the motion, we also want to hydrate our discs. So we've got this wobble disc here. Shell, can you take a seat? Now your discs are nourished by movement. They actually don't have a blood supply, so they rely on a pumping movement to push nutrition in and suck toxins out. If that disc gets stuck, especially if those little joints at the back are stuck, it starts to dry out and desiccate or thin. And this is actually what leads to arthritic change in the low back. So this exercise basically primes and nourishes the disc. So you sit on it and then simply rotating from side to side gently, creating a pumping action in the disc in your low back. Now, if you've got a sore low back, this is usually pretty good for it. Make sure you're staying within a pain-free range of motion, but you're just getting a nice gentle stretch. This is great if you're sitting at the desk, if you're sitting on a long trip in a car, you can do this. If you get the right disc, you can take this with you anywhere. Or if you've been standing all day and you want to get some movement through your low back, jump on these discs. Do it for about 5 minutes. You can do it when you're watching TV. I mean, you can do it having dinner. You can do this as just a part of your regular day to fit it in. So again, it's not a burden. It's actually going to help. Now, the last thing, so we've just improved the range of motion in the joints. We've hydrated the discs. Now we want to help lock it in by activating a thing called proprioception, which is the signal to the brain, so your brain can start to lock on to where that joint is so it's got better control. So can you stand up, Shell? A simple thing you can do at home is stand on one leg. So this is all about being off balance and forcing your brain to recalibrate the small muscles in your spine around the joints to give it stability. So if you can hold this for 20 to 30 seconds, swap legs. If you've got an annoying spouse, they might want to push you. But the idea is you're challenging that balance system and you're strengthening it. Because make no mistake, if you strengthen a muscle, it gets stronger. Well, if you challenge any of these systems, your joint movement, your balance system, they also get stronger. Super important, really good for low back pain. Now, in our office, just to give you a quick peek, we do a lot more, advanced setup of this, where we go through different range of motion, we use lasers and all sorts of things to really get the most out of it. And this is how we really not only get better results faster, but lock those results in so you get a lasting change. Using things like spinal orthotics, special neuromuscular re-education programs, which is a balance training, the whole 9 yards, special adjustments. Now, if you're watching these videos and you want to know if we can help, if you're not sure, if you're on the fence, I get it. That's why we offer a free over-the-phone consult with one of our docs, because you don't know, everybody's unique. So get on the phone with one of them, tell them your problem, tell them your story, let them walk you through it, and they'll find out whether you're a good candidate for what we do or not, whether it might work. And if it is, then they'll walk you through the next steps so you can get baseline tests, they can start to work with you, retest, so you can actually see it changing over time. It's a really cool process. Anyway, I hope to see you in the office soon, but if not, I'll see you in the next video.